Yeah.
Wait, which one? Your presentation, your paper?
It's on the USB.
It's
plugged in.
Go right ahead. Okay. May I have a corner somewhere?
Yeah.
Like the spoon is doing.
That's perfect.
No, I got a good view.
Yeah,
actually,
Go sit in one of our chairs. Oh, right there.
Right there in the middle.
Right in the front.
See, that's it. Warmed it up. Yeah.
They're going to see them giving you Oh, you don't mind them seeing that?
At least we know we gave our A game.
Go right ahead.
Okay, so good morning, everyone. Queen's crew in the house.
Wow.
So today we'll be discussing infertility. Okay, so the evaluation and management of an infertile couple requires an understanding of the processes of conception as well as sensitivity to the emotional stress that can result from the inability to conceive. Infertility is a diagnosis that impacts millions of women and men in the country. Approximately 10 to 15% of couples in the United States are infertile. Our group today will be discussing the causes of infertility and the issues related to infertility, the treatment options regarding infertility, both pharmacological and non-pharmacological, and we will also discuss the therapeutic coping with problems.
Okay, so what is infertility? Infertility is diagnosed after 12 months of unsuccessful conception with the same partner and without any use of any type of birth control. And welcome all to the Jelly Show! Thank you. Today we have Mo Cheeks and Finn Igan. They're going to be talking about their story about infertility. Why don't we bring them on in?
You guys haven't had
Okay, so tell us a little about yourselves.
Well, my name is Finn Igan, and I'm a lawyer. I can sue everybody here, by the way. So jerking around. But anyway, me and my wife Mo over here, we've been trying to have a baby for 2 years now.
Hi guys, I'm Mo, and I just want to say thank you for having us on the show. It's such a pleasure. Now, it's been a lifetime goal for us to have children. I come from a huge family, but I've been having some fertility issues for quite some time, and it's been an uphill battle.
Okay, so what are the causes of infertility? The number one cause is polycystic ovarian syndrome, and this is endocrine system disorder when the ovaries of the woman are enlarged and are filled with fluid, and this may cause irregular ovulation or lack of ovulation. Decreased sperm production could be another reason. Endometriosis, this is when uterus cells grow in other areas of the body, causing scarring in ovaries and fallopian tubes. Tubal occlusions, that's another reason. And for example, adhesions are formed in fallopian tubes due to infections. STIs such as chlamydia can cause infections and infertility. Body weight and substance use are factors that affect fertility, and very often the cause cannot be identified. 50% of infertility cases are unexplained among women under 25, and 80% of infertility cases are unexplained among women that are 40 years and above.
So a number of diagnostic tests can be done to test for fertility issues. Usually it starts from the least invasive to the most invasive. We're going to talk about a few here due to the shortage of time. But we'll start with the semen analysis, is where someone ejaculates semen into a cup, and the amount of semen that is released is measured, and the quality of the sperm is also taken into account. Another test that is done is the pelvic exam. This is where an instrument is inserted through the cervix into the lower part of the uterus, and the dye is injected, And the doctor follows this dye with a fluoroscope and takes pics to see if there's any urine abnormalities, polyps, or any fibroids. Another one done is the postcoital test, which is after intercourse. You check the cervical mucus of the female for the presence of moving sperm after intercourse, before or right at the time of ovulation. Lastly, a laparoscopy test is done, is where a small incision is made in the navel, and the telescope is placed through it to look at the internal reproductive organs. Another incision is made, and another instrument is inserted to move the organs around to make sure there's a clear picture of all the organs, and to check for any scarring tissue around the ovaries and tubes.
So, how did you two find out you were having infertility issues?
Well, we were really looking forward to making babies.
That's part of it. We got to do it all the time.
Well, we had all these diagnostic tests performed. I had a pelvic exam, and I had an endometrial biopsy, and Finn, he even had his semen analyzed, but all results came back inconclusive.
Yeah, we had to change our diets and everything. We had to consume foods with more folic acid, and I had to eat more nuts. But the worst part was that I had to stop smoking the ganja. That was hard.
And he also had to stop leaving his cell phone in his pocket because the radiation was killing his sperm.
All right, we'll be right back with a short commercial break.
Are you feeling like a whipple match? Are your sperm not working? Try Sperm Magic. Generic name Sperm Can Swim. Has been proven to help men in hard times. Talk to your doctor before. May cause DIC, depression, erectile dysfunction, night sweats, night terrors, peak of projectile vomiting, drowsiness, hair loss, skin diseases, Mongolian spot, cirrhosis, blindness, glaucoma, infection, and can cause death. Once again, try Sperm Magic.